In this video, I'm going to talk about different forms of GI atresia that can happen during embryonic development. And the first condition I would like to talk about is duodenal atresia. So during normal embryonic development, at around 6 to 7 weeks of gestation, parts of the duodenum will get occluded due to the proliferation of the endodermal epithelium. However, at around 8 to 10 weeks of gestation, there would be recanalization, and thus duodenum will open up again. However, in some patients, like patients with Down syndrome, which is the same as trisomy 21, there is problem with recanalization, and thus duodenum will remain atresic. And so these people will present with polyhydramnia during pregnancy. So since they cannot eat the amniotic fluid during pregnancy, there would be too much amniotic fluid, which is also referred to as polyhydramnias. Now you know that the biliary duct also goes to the duodenum, and since these patients have the first part of duodenum still there, they would develop bilious vomiting soon after birth. And if you obtain an X-ray of these patients, what you will see on the X-ray is 2 black bubbles, and it's referred to as a double bubble sign. The next condition I would like to talk about is the atresia of the ileum, jejunum, or the colon. So these are usually caused due to the vascular accidents. So if for any reason there is problem with blood supply to the part of the GI tract, then they would develop ischemic necrosis. And since these tissues are still sterile, they would be resorbed, and what remains of them would be blind ends, a proximal blind end followed by a gap, and then a distal blind end. One other more severe condition is shown here, and it happens when there would be volvulus around the superior mesenteric artery. And so if you recall, the GI tract, the parts of the GI tract that are derived from the superior mesenteric artery include the distal duodenum, jejunum, ileum, and part of the colon up to the transverse colon. So most of these tissues will be lost if there is problem with vascularization of the superior mesenteric artery. And in these patients, what you will see would be a proximal atresia followed by a huge gap, and then the distal colon will wrap like an apple peel around the artery. So what I mean here by apple peel is that, so if you have an apple and you start peeling it, so you just keep peeling it like going all the way around it, it would resemble like this. And so that's the same pattern we'll get in these patients. So there would be an apple peel appearance. So just to summarize, duodenal atresia is caused due to problem with recanalization, and it's commonly seen in patients with Down syndrome. And then ileal, jejunal, or colonic atresia is seen due to the vascular accident. And then apple peel is characteristic of some of these forms of atresia. And that concludes our discussion.